All right, we're going to go ahead and get started. So, hello everyone, and welcome to day two of the virtual pharmacy school fair. I am Danielle Stubbs Kirkland, and I'll be moderating this session. We'll get started with today's session. Dose of Impact, how pharmacists change lives every day in just a moment. But first, just a few housekeeping items. For the most part, you'll be muted throughout the webinar, but please feel free to ask questions in the chat window. There'll also be a couple of times where our speakers might prompt you to unmute, and then you can ask questions and participate. We have also saved some time after the presentation to address any questions. But if there are any questions that we don't get to, the speakers will be available in their booths during the expo hours from 5 p.m. to 7 p.m. Eastern. So we highly encourage you to visit their virtual booth at that time. Additionally, this presentation will be recorded and available immediately afterward in the sessions tab. Now we'll turn it over to our speaker to get started.
Hi, everyone. Good afternoon. My name is Deanna. I am a Director of Member Relations at ASHP, which is the American Society of Health System Pharmacists. And today's presentation is Dose of Impact, How Pharmacists Change Lives Every Day. So I really want to make this session a little bit more interactive. So hopefully you guys got a good luncheon and you guys are ready to kind of rock and roll with me. I would love to see you guys in the chat, as well as there'll be a few times where you can stop and ask some questions. So feel free to unmute. If you feel comfortable, I'm happy to, would love to see your faces. I think you can also show your camera as well. So as a heads up, because we're going to be interactive, there will be a QR code. I'm going to ask you guys to do a quick survey with me. So I just want to give you that kind of heads up as we go through today's presentation. So I'm going to start by giving an introduction about myself, my journey to pharmacy and my career path, and see if that potentially could resonate with you. That will also allow you to ask maybe some more specific questions about my career path if that kind of resonates with you. And then we'll turn it over to doing that interactive portion so I can learn a little bit more about you guys. Okay. All right, so let's go ahead and get started here. So my path into healthcare, so I first, even when I was young, I've always kind of gravitated towards learning more about the sciences, but I didn't know if healthcare was really, what I wanted to do in terms of my career. So I started volunteering at different places, including a local hospital in my area, doing different things, going to different departments and learning about what they do. And I realized that healthcare was really something that allowed me to take science and also kind of combine it with helping people. Really loved doing community service in my neighborhood at the time when I was young, and I still do. So I really kind of put those things together and said healthcare was something that I was interested in. But what in healthcare I wanted to do, I wasn't quite sure yet. So my cousin is a pharmacist. She worked in long-term care. And so I started, chatting with her, learning more about what she does in pharmacy. And so then a job opportunity opened up at Rite Aid. So Rite Aid is kind of very similar to like a CVS or Walgreens, if you're more familiar with those two chains. So it has like a front end where you could just buy different things and the back end where there's a pharmacy. So I first started as a cashier, just working the regular in the front side of the business. And then when I started talking with the pharmacists, getting to know the pharmacists more, and then when an opening came for a technician job, I went to the back of the pharmacy and I really learned a lot more about what community pharmacists do, how they impact patient care and help our patients. And it was then that really confirmed that I really wanted to do pharmacy. One of the big things about why I gravitated towards pharmacy versus, let's say, a physician or a nurse was I realized quickly while shadowing at the local hospital that bodily fluids was just not my thing. I'm okay with stabbing folks a little bit for some blood for samples or for vaccines. Actually, I love giving vaccines. I think it's such an important thing. But bodily fluids in general wasn't my cup of tea. So that was one thing that kind of confirmed my role into pharmacy. But another was just that I really wanted to have a better balance for family and my job, for my job aspirations. I just felt like personally for me, a physician, there's a lot more years of training, and I just really wanted to be able to finish training and get straight into helping patients and being able to have more balance with family. And so that's kind of one of the other reasons that got me into pharmacy. So once I decided to go into pharmacy, I was going to go all in. So I went to the University of Maryland College Park for my undergraduate. And when I finished my prerequisites in 2.5 years, I then applied and got into pharmacy school at the University of Maryland School of Pharmacy. And then from there, because of my love of community service and working with patients in the community pharmacy during my time with Rite Aid, I then decided to do a postgraduate year one. So my first year out of pharmacy school, a residency program, a community-based residency program with Virginia Commonwealth University and a grocery store chain called Martin's Pharmacy. So from there, I really loved staying in the ambulatory or community pharmacy space, and a position opened up back at the University of Maryland, and so I came back there to be a professor. And I've been a professor at the University of Maryland for 14 years before I came into this position here with ASHP. With ASHP, you're probably wondering, well, what is ASHP or who is ASHP? So as I mentioned, ASHP is the American Society of Health System Pharmacists. And I think of kind of like if you've watched the Avengers or Marvel movies, it's like ASHP is that for pharmacists. We are the professional organization that helps pharmacists, student pharmacists, and technicians who work in hospitals, home care, outpatient community pharmacies to be able to help them do their jobs better and care for patients safely. Specifically for me, I work with pharmacy students. That's my main job and role, is to help pharmacy students succeed, especially in residency if that's where they're interested in, or in hospital and health systems. All right, so that was a little bit about me. I would love to get to know you guys now. So what I would love is you can scan the QR code here, or you can go to pharmacyforme.org for the pharmacy career quiz. And it should take about a minute or two if you would love to kind of join me on doing the career quiz. And I would love to see what kind of pharmacy career pops up for you. So once you've done this, let me give you a few extra instructions. What I would love for you to do is what we're going to do a waterfall chat. So in the chat box, you will put in what pharmacy career came up for you from the quiz, and then you're not going to hit enter. So you're just going to put it into the chat box. And then after a few minutes has gone by, I'm going to say waterfall, 3, 2, 1, go. And then at the go, you're going to hit enter on the chat, and everybody's answer is going to pop up on the chat box. Okay, and then we can talk about kind of what careers everyone here today is interested in, and we'll try to talk more about that as we go through the next few slides. So with that, I'm going to give you guys a chance to go and do that for a few minutes. And then also to help me maybe gauge where you guys are, once you're done and you've put in your possible pharmacy career in the chat without hitting enter, if you could give me a thumbs up, that would be great. Another thumbs up here. Just waiting for a few more. Awesome. Thanks, Kevin. Another thumbs up, very good. Make it maybe another 30 seconds or so. Can't wait to see what you guys have for your pharmacy career quiz. Okay, let's go ahead and do this waterfall. So I'm going to say waterfall. 3, 2, 1, hit enter. Oh, I love it. All right, I see infectious disease, hospital pharmacist. Oh, another for infectious disease, pediatric, cardiology, nuclear, two cardiologies. Wonderful, really great career opportunities. All of these actually are in hospital health system practice as well. So that's really, really great. So we'll definitely try to hit on some of these as we kind of go through the different hospital career options. Thanks, guys, for participating. So as you guys could see by doing this career quiz is that pharmacy careers exist everywhere where healthcare exists. And I think that's one of the cool things and really great things about pharmacy is that we need medications in every sort of space, right? We have people who need them when they're at home, when you are sick, maybe with a cold and you need to go get something over the counter and there's a pharmacist there that could help you, a pharmacist in the hospital settings when you get discharged from the hospital and talking with a pharmacist about the medications you might need. So there's really in every spectrum of healthcare, that's where there's medications and that's where there's also a pharmacist. Fun fact, if in case you guys didn't know, there's even a pharmacist at the Olympics, since right now everyone's talking about getting tickets to the Olympics. So some of the career paths include community. So my background is actually in community and in ambulatory care. I've been doing ambulatory care for the past 10 years. So community includes like some of our chains that you might have heard of, like CVS and Walgreens, but we also have some independent pharmacies. Does anyone know, and you can put in the chat, what do you guys know of independent pharmacy or what is independent pharmacy? Private, I'm hearing from Kim. Good. Yeah. So it's not like this large chain setting. Exactly, Kevin. It's a family-owned store. So think of like a mom pop shop. It's a little bit smaller. There might be a few that the family might own, but it could be, I think of independent pharmacies as the ones who really know their communities. They're in their community space. They're helping, being really involved with their community. And sometimes the independent pharmacies are the ones who are innovative. They really are thinking about what is their particular community need and doing some services specifically for their community. Really good. So we also have hospitals. So I named some really common hospital systems that you might know, including like St. Jude's or Johns Hopkins. But there's hospital pharmacists, both that help with making the medications, like the IV bags. Also those who work on floors like in this picture, where they're on a specific floor, like the cardiac unit or the IC unit, and helping, talking with nurses and physicians, working together in a team to help that patient. We also have clinics, which is what I think of like the ambulatory care clinics, and we'll talk a little bit more about that in another few slides. But it usually typically is kind of centered on specific disease states. So like cardiology, for example, where you have pharmacists. We also have public health pharmacists. So these could work in government agencies like the FDA or NIH. We also have those in the Indian Health Service and other places where there's public health service officers. You can do education like I did. I was a professor at the University of Maryland. So you can also teach. So you could be an instructor while you're also helping with pharmacists and working with patients. You can work in industry. So using that science and pharmacy knowledge to help develop medications or with clinical trials to kind of help those medications come to fruition. So this could be like Pfizer, Johnson & Johnson, and Moderna, and so forth. At the very end, I have national defense. So you can also be a pharmacist in the Army, Navy, Marine Corps. Such an important job to help make sure that these groups of important folks also get their medications and are taken care of. So lots of different career paths. And all of them have different needs. So the main career paths that, in terms of this is really that we have a pharmacist, but we also have a pharmacy technician. So two very important roles in the pharmacy department. And ultimately, they work together to help keep patients safe. Both of them are really great paths. So a pharmacy technician often focuses more on helping to prepare the medication. They support the pharmacist so that the pharmacist can do certain tasks that are needed, including talking more potentially with patients or with physicians. So they really help support the workflow, making sure that the medication is prepared and gets back to that patient safely. And then you have the pharmacist. So the pharmacist is more focused on the clinical medication decisions. And a big piece of that is checking for safety. So the pharmacist looking at the medications about whether or not there are drug interactions, so other medications the patient might be taking that could interact with the medications being prescribed. Are there allergies in which this medication may not be best for that patient? And also thinking about, is this the best medicine, right? Because the pharmacist is thinking about their whole body, kidney function, liver issues, all that stuff to think about, is this the best medication for that patient? And they do a lot of communication with doctors and nurses and also really getting the patient involved in that process. So what I probably alluded to in terms of talking about that is how pharmacy really matters, right? Pharmacists exist because there are medication decisions that need to be made, especially in a hospital setting. You can see here lots of folks, a lot of different healthcare members talking together in a team environment to make sure that patient is being safe. And we do that by monitoring and adjusting medications over time, especially in a hospital setting where a patient is more critically ill, and making sure that they are getting the medication at the right time and based upon how they're doing, whether or not that medication needs to be adjusted. And through that process, we really help to prevent serious harm and potentially save lives. So let's talk more about the different types of major types of pharmacy that we talk about. So I want to focus on a few because we have limited time together. The first is community pharmacy. So we touched a little bit on this. This is where a lot of patients first see a pharmacist, is that community pharmacist, where they get their medications filled, they can get counseled and educated on medications. And the safety check is really important here for that community pharmacist, checking to make sure that medication is safe and effective for that patient before it leaves the pharmacy. So as I mentioned, it's often that first healthcare professional that a patient sees. So really is an important piece of the pharmacy healthcare team. Next, we have our hospital pharmacists. So this is where medications are often used for critically ill patients. So as I mentioned earlier, you really got to look at that dosing and timing. They need a pharmacist to really help make sure and closely monitor that patient with that medication. And also pharmacists work really closely with other healthcare team members. So this could include the nurses, the pharmacy technician, the MAs, and so forth. Because a lot of times the decisions may be fast, it needs to be precise, and errors could lead to immediate consequences. So here's just kind of an example, kind of giving you an idea of a hospital pharmacist and how they work in a healthcare team. You have a physician who would write the medication order or the prescription. You have the pharmacist who's doing that safety check on that medication, the nurse who would administer the medication, and then hopefully the patient is getting better. So really have just one glimpse of this team environment that we have to really make sure that we're helping that patient. So no one can really do it alone in healthcare. We really are doing it together to make sure that the patient is feeling better. Another one that we mentioned was ambulatory care. So here we have one-on-one patient counseling. So in a ambulatory care setting is when a patient they're ambulatory, so they can walk into the office and they can walk out. When I think of an ambulatory care clinic, I think of it kind of like a physician's office where you're in a room with that patient doing one-on-one education, counseling. You may be reviewing their labs, their health data, and helping to adjust their medications with the help of their provider over time. So think of like, let's say, a diabetes clinic or a asthma clinic. So you have a specific disease states or a few disease states that you're working with that patient, and you're helping to manage those chronic conditions over time to help prevent complications and to help prevent them from going into the hospital. know. What's really great about ambulatory care, very similar to community pharmacy, is that you're really building those long-term patient relationships. You're seeing them potentially every few weeks or once a month, very similar to how in a community pharmacy setting, you might see them a few times a month because they're coming to pick up medications at different times of the month. So to give you an idea of how we work together in a healthcare team in an ambulatory care clinic, here's an example of geriatrics. So for our older patients, you have an older patient maybe with multiple conditions, maybe mobility concerns, some chronic conditions, and they come into the clinic. So you would have a nurse or a medical assistant who is performing the intake, checking their vitals, talking about, seeing what they need. You have the physician that's checking on their disease state, helping to set goals, overall goals for that patient's health. The pharmacist who's checking on the medications, maybe educating or adjusting those medications to improve its efficacy and its safety. You might have a physical therapist or an occupational therapist or a social worker who also is helping with all these other aspects that the patient might need. So we're working again in that team environment to help that patient. So I saw in the chat about the interest potentially with cardiology, infectious disease. So here are some of those other specialties that you could really have. Some fun facts is that qualified pharmacists can also be board certified, very similar to how potentially a physician could be board certified. So that's something to kind of keep in mind with some of these specialties, especially if you're gravitating towards some of them. And another fun fact is that pharmacists can also run hospital codes. They work in the emergency room. They might be mixing the medications right there and then, need to be really precise to make sure that the patient's getting exactly what they need to help save their lives. So that's a really cool thing about kind of those as potential other specialties. So kind of driving home my last point again is that team-based care. So no one in healthcare works alone. Leadership is really shared, and pharmacist is really helping in that one component. So a lot of times I think of, the pharmacist as that medication expert. We have done 4 years of training, a doctor of pharmacy degree. We really know medication. So in a team environment, we can help talk more about the medications, help think about the medications in lots of different ways to help support the overall team to help ensure the patient stays safe. So with that, that concludes my short presentation. Would love to hear from you guys what questions you might have.
Thank you, Dina, for that great presentation. So yeah, please feel free to put any sort of questions that you have in the chat. And you can also unmute in this one and ask any questions out loud if you'd like.
Yeah.
I actually did have a quick question for you, Deanna. Can you talk a little bit more about ASHP and I guess what sort of opportunities there are for students to get involved if there are any, or maybe post-graduation?
Yeah, so I'll talk about it in kind of different buckets. The first would be with different pre-pharmacy organizations, especially ASHP has been working a lot with HOSA. So if you are involved in your local HOSA chapter, I think that there's opportunities for us to kind of help collaborate and share pharmacy resources as you guys learn more about the pharmacy career. In terms of as a pharmacy student, we really focus on helping you guys succeed in what you need after graduation. So especially if you're interested in residency or some of these specializations that you guys have put into the chat, that's really what I work on. So we do educational programs. We have lots of tools and resources, spreadsheets, PDF documents that really talk about all the different steps that you need. So in your first year of pharmacy school, what do you need to do to help you be prepared if you would like to be a resident? In your second year, what do you need to do in terms of leadership or research or getting involved in health system and maybe shadowing? So we kind of have all these tools. I think of it like a roadmap through each of the years to really help you guys be successful. And we have tons of tools and we do roundtables and webinars throughout the year as well to really help to support those efforts.
Awesome. And there's actually a question in the chat. How would we pick a specialization? Is it like with doctors and matching day?
Oh, that's a really great question. So, there are, I would say that right now in our pharmacy profession, you could specialize with a residency or without a residency. I think that it's kind of up to you in terms of how intense training you would like. I think of residency as a place to get that additional training, best practices, and 1 year of residency is kind of equating to like 3 years of experience, but more in a condensed period of time. So let's say you're interested in pediatrics. Some suggestions would be to shadow, talk with other pharmacists that work in pediatrics and that specialty to learn more about it. And there are potentially some job opportunities that you can go straight in from pharmacy school into pediatrics. I will say that it's typically a little bit harder to go into a specialization without a residency. Residency really helps to give you more experience, more background, some more best practices. There's a lot of mentoring in residency, so that way you can really go into it. In terms of how you pick specifically, I think it's really great, especially during your pharmacy school time, to learn about different pharmacy careers. So just like, with this pharmacy career quiz, it gives you a glimpse into it. And you can read more about each of those different career paths and see what kind of interests you. Do you like talking with patients? Do you like working really in a high intense environment like the emergency room? So learning different things about what you like and then exploring those opportunities during pharmacy school to kind of see if that really confirms it. So that way, when it's time for you to pick what type of residency, you can kind of go into that. We do have a match process, very similar to physicians. That match process allows you to choose which residency program you end up with in your PGY1, so first year after residency school, as well as the second year residency school.
Thank you. Any other questions? We have a few more minutes here for questions. So feel free to put them in the chat or unmute. Why did you decide to move on from teaching to work at ASHP?
I love this question. I love working with students. And so when this opportunity here at ASHP opened up, I thought it was an opportunity to do even more because I was helping students grow and mentor them and helping them, get to where they want to go after pharmacy school. But I was doing it only at my university. And here at ASHP, I can do it for everybody, all the pharmacy students that work within ASHP, that I serve as with ASHP. So I really think it's more about being able to open up and do even more with pharmacy students and help to support them. So that's kind of why I gravitated towards working with ASHP.
Oh, that was a great question. Any more questions?
Well, thank you guys so much. I really enjoyed learning and getting to know you guys. If you guys do have questions, please let me know. I'll be in the next one.
Awesome. Yeah, so I think with that, we will close out this session, but thank you again for attending this session. And like I said, if in the introduction, if you have any questions that you maybe couldn't think of today or during the session, please feel free to visit the ASHP booth during the expo hours from 5 p.m. to 7 p.m. Eastern today. Thank you again, Deanna, for this great presentation, and hope to see you all in the next session. Thank you all.